Hi, this is Vero from Choose to Be. Today we're going to do a physical test. So to do your physical test, there is quite a few things, a few steps we're going to do. There's a big plane over my head. So one of them is taking a picture of yourself facing the front, the side, the back. So you might need some help taking measurements of yourself, weigh yourself. And then there will be more of a physical component of that physical test. So to measure yourself, I use what it's called a myotape. I really like it because it's easier to do all by yourself. It's simply something that pull, and there's a little button here. You can put it in the loop and then you pull the button and it squeezes. So it's really easy to do when you measure yourself. You can just use a regular tape, that's fine as well, but in case you want some extra help, this is really handy. So when you measure yourself, you're going to measure, I'm going to show you the different place you're going to measure. One of them is the chest. So when you measure your chest at nipple height, making sure, so I just put it around like this, I put it through the loop and then I press the button. So making sure it's all in one line. Sometimes it can go in an angle in the back. You don't want that. You want to be straight. Then the other place you're going to measure is the waist. So the waist is where it bends. So if you're having a hard time, you can bend sideways and see where it bends. So it's the narrow place of your torso. Then it's the hip. So for the hips, you put your feet together and you measure the widest part of your bum, so the biggest part of your bum. So you measure this here. Then, and I like to do it when I face sideways so I really know. Then is the thigh. So you're gonna measure pretty high on the thigh because you want to have that little fat extra here on the side, but you don't want to grab the glutes. So just make sure when I do this, I face the mirror so I can see. So just making sure you're not grabbing the lower part of your glutes. So high enough, but not too high that you grab the glutes. That's mainly the place I want you to measure. Some people will measure the bicep. If you do it, you can contract it or not. It's up to you, but take as many notes as you can. For example, when you measure your chest, if you inhale and you have a nice inhale that expands the rib cage, that makes a difference. So just try to have a normal breathing, not expanding or contracting the rib cage, just trying to be normal. Some people measure their calf. I did it over the year. I measure lots of people with their calf. Mainly what you can see. You can see a slight difference, and often it's from water retention. So if you start being more aware of what you eat and cut more salt, you might lose water, which will show in your calf measurement. So, and if you decide to do this, just measure at, again, where it's like the biggest in your calf. You just measure there. It can be tricky to take measurements because a little bit higher, a little bit lower will affect that measurement. So just try to note as much as you can. And then weigh yourself, same time of the day, because if you weigh yourself in the morning or at night, it make a huge difference. Anyway, for me it does, and for most people I've been weighing so far. I like to weigh myself naked in the morning. It's up to you. Don't weigh myself often, but if I do, that's when I do it, so take note. And now for the physical part, well, I was not thinking there will be that many planes here. Okay, for the physical component of the test. So what I want you to be aware is your spine alignment. So you can think of your pelvis as a bowl of water. You don't want that bowl to leak forward. You don't want it to leak backward. You want to make that bowl nice and level. So you can think about, I often refer to that, tucking the pelvis under. So elongating the lower back. The rib cage is in. So you're connecting the pelvis and the rib cage together. So you're engaging through the core and the chin is tucked in. So you're not pushing the head forward, which creates lots of tension in the upper back. So ears above the shoulders. So always thinking about that spine integrity. So from this position, the first thing we're going to do is a squat. So your toes, your feet hip width apart, parallel. You can have a slight turn out too, that's okay. You're gonna put a chair behind you, you're gonna squat, touch the chair, and then you're coming back up. So the movement is initiated by your bum going out, touch the chair, then come up. If you're more experienced, you touch the chair, add a little hop. Sounds good? So you're gonna do that for a minute and see how many you do. Use the same chair when you redo your test 2 more times. So you just have an idea of the depth you're going. Making sure the knees are aligned, so you're not going in, you're not going out, you're just keeping the knee aligned with the toe. And again, nice engagement through the core. Then the second movement we're gonna do will be a hollow body position. So again, super important that tuck here. So you're gonna be laying onto your back, legs up, hands by your side supporting the head, or here, you're gonna lower the leg and stop just before your lower back leaves the ground, and you hold this as long as you can, maximum for a minute. I would like if somebody can take a picture of where you lower your legs and hold them so you see the progression. And stop before the back arch, so your lower back is on the ground, flat. If you feel your lower back in that position, that's a really good sign that you're going too far down. Sounds good? Perfect. So this is called hollow body position. I want you to keep that position to do your plank. So you're going to test yourself straight arm plank or forearm plank. Either way, it's okay. So here we go. I'm going to be into your plank position like this. Shoulder above the wrist. Nice long spine. No banana bum. No arch. Not too low. Just a strong core gazing in front of the hand. So just thinking of all the alignment, and again, I would like if somebody can take a picture of you, so that will be really handy to see your form as well and see the progression of your form. And if you want, you can always send me that, and then we can discuss what you can change. The last thing we're gonna do is a lunge. So if you're new with lunge, you have 3 90-degree angle in between your legs. So as you see, you're not on a slack line. So your feet are hip width apart. I say railroad track instead of a tight line, a slack line. So feet hip width apart, back toes are pointed to the ground. I stand up. I keep this knee bent the whole time. I come down, then I come back up. Down and up. If you are on a soft surface, I will recommend you that your back knee touch the ground each time, then you come back up without locking the front knee, and you try to do your maximum in 1 minute. If you're challenged with your balance, or if it's hard for you, start with a chair by your side to help you and support you, and don't touch the back knee to the ground. If you feel any knee pain, don't do it for now, and within the weeks your legs gonna become stronger, you'll have better knee alignment, and it should hurt less. So yeah, I hope all of this information help you. We're gonna do that fit test on week 1, on week 4, and on week 8, so you can see a nice progression. You can monitor your progress, and yeah, I hope this is helpful. I will see you soon. Thank you.